Cancer awareness and its prevention, especially in the woman I'm taking. Cancer is not a zodiac sign. And today, as I already said, today is October Breast Cancer Awareness Month. And I thank Swarupa Madam for making me this part of this October Breast Cancer Awareness program by giving or making you all aware on this topic by giving me that opportunity. So I've already said that today is National New Friends Day. Look at that, different race have become a new friends, and I have got so many friends today, 34 friends or 35 friends are there for me today. One person had it.
Thank you, madam.
Thank you so much, Lavanya. And it is like we have to live this life to inspire, and one day people will say, because of you, they didn't give up. So you should be one person who should be inspiring. And when it comes to cancer, the only choice we have is to get up and face it. So all these things are statements which are given by the celebrities of India who have come out of that cancer episode successfully with all the barriers. So in the cancer affected patients, all these persons who have written, your journey is going to be hard, but try to fight it with a hope and remember to switch on the sunshine and take one day at a time. So I think this was written by Yuvraj Singh, cricketer. Our great celebrity and movie actor has written a book on this, that is Healed, How Cancer Gave Me a New Life. That is Manisha Koirala, movie actor. So why there is a rising number of women cancer? Let us know today, and that's the need why we need to be more. We need to give more awareness and help in preventing the risk factors. So, what do you think are the main causes of cancer in our country? Is my first question. What do you think? Why is cancer so rampant? Like when we were child, when we were kids, this was not that much. But nowadays, you can see every house is cancer affected person will be there. Why? What?
Pollution, madam.
Yes, exactly. Pollution and
Lifestyles,
lifestyle. Very good.
food,
Food habits, food
food
habits,
habits.
Food
usage
habits,
of plastics,
usage of
use,
plastics.
In some cases, heredity also.
Yeah, genetics, family. Yes.
uses pesticides in all food items.
Yeah, or that food habits. Okay.
Stress levels.
Pardon? Stress levels. Yeah.
Stress levels,
Okay.
yeah.
Stress factor. Then so let us look into that. What exactly are the factors? Because if you ask the social media person, they tell that whatever you pick up from this only, cancer will be coming. So let us not going to blindly listening to those social media things. Like, let us understand what exactly is going to cause the cancer, causative factors, and what and all we can prevent them. Lifestyle habits or whatever. See, the major causes of the cancer are, most of the times, it is a tobacco chewing, smoking, inadequate take of fruits and vegetables. That's a fiber diet, inadequate fiber diet, excessive intake of alcohol. Nowadays, it has become a lifestyle that even male and females both are considering it as fit status. So then obesity, because of less physical activity and too much eating. Because earlier days, food was not that easier to eat. Nowadays, it is very easier with the availability of Zomato, Swiggy, and both working parents in the home. And too much of sun exposure. Of course, this doesn't match to our situation because we always stay within the homes with less sun exposures. And less common things are like genetics will be there, pollution, as Lakshmipati and Lavanya said, and occupational hazards. So all these things will be there. But main things what we can prevent, we cannot prevent this genetics and all. And whatever occupation we are doing, at least we can shift to the other occupation if you know. And pollution, at least you can stay in an environment where there is a less pollution, or you can contribute to the less pollution, or some programs like that, so that you can slowly. But what is there within you which you can change yourself, so that you are going to prevent cancer? Genetics and all you cannot, but what exactly you can do it for yourself single alone, which contributes to more, is like tobacco chewing, that you can avoid on your own, smoking, and also intake of fruits and vegetables you can increase. So excess alcohol intake can be minimum, or you can avoid them. And all this, of course, exercise and good mind habits of eating habits will definitely prevent the obesity. So, and all these things are there in our hands. It is already said that anything, if you want to change, you cannot change any other person. Only person you can change is that's you. So take care of yourself by not going into all these habits, because there are chances that there are major chances that cancer is going to affect in these patients, like lung cancer, alcoholic liver cancer, stomach cancer without taking up of this fruits and vegetables, obesity, different cancers will come. Sun exposure again will cause the skin cancer. So who can get cancer? Who will get cancer? Which age group will get cancer? Anyone can answer this one?
Any age, madam.
Any age
Yeah.
can get answer, exact answer. So any age, whether it is young, old, men, women, children, any age can get cancer. There is no age limitation to the cancer. So then what is this cancer exactly? What is this cancer? Cancer. What is this cancer?
Unlimited proliferation of cells, madam.
Yes, unlimited proliferation of abnormal cells.
Yes. Yes.
So this is the cancer definition. So it is uncontrolled growth and spread of abnormal cells. When it starts spreading, it is called invasion. When it starts growing, it is called cancer. So metastasis means when it spreads. So growth means when it stays in a single place. So if this spreads too much into the all the parts of the body, that is metastatic, then death, it causes death. So this is, you can see here, one cell became the abnormal, and later that came from the normal cell itself. So maybe because of all the contributing factors which I have told, risk factors earlier, and then because of that it became 2, 4, and so on, and it will become neoplasia. What exactly is the number of cases in a females, and what cancer? Lavanya, can you just mute yourself? Then which is the actually most common cause of cancer in the woman? Most common cancer in the woman is like it is a breast cancer. Second comes the cervix cancer. Then comes the ovary, which is very lethal one. If at all it occurs, like it is a dangerous one, very fast spreading, and lip, oral cavity, and then colorectal or other cancers will come into the later. So first is the breast cancer, and then is the uterine cancer. So let us concentrate more on the breast and the uterine cancers for today, how we can prevent them. Then if it comes to male, so it is like a lip and oral cavity, maybe because of the causes I said, like tobacco chewing and all, and lung cancer, smoking, stomach because of inadequate intake of vegetables and fruits, and colorectum, same, and esophagus, all these things. So, and all other cancers will be there. So more than almost half of it is because of all these things, which can be preventable. And second thing is like most important thing is in our India, if you take, most of the cancers are occurring because of the infection which is neglected or not treated properly, or chronic infection, repeated infections of cervix, stomach, and liver, colorectum, all these things because of the repeated infections which are neglected or not treated properly. So in that case, this infection is going to convert it into that cells becomes abnormal, and so it is get converted into the abnormal cell proliferation, leading to the cancer. So kindly take care of the infection, especially in the cervix area and also stomach. How age is going to, so as the age increases, the cancer incidences is also increasing, and after 85 it is going to decrease again. 85 is the maximum, but whatever age it is, even less than 1 year also there is the incidence of cancer. With this graph we can make out, though chances are less, but it is there. I hope you are following. If you are following, kindly keep a chat like yes. Keep a message in the chat box saying yes.
Yes, madam.
Yes. Okay. You can keep a message in a chat box. Yes. Yes. Okay. Good. So then warning signals for cancer. So what actually body will say, like it is going before the fits also, fits or seizures, body will give some signals. So likewise for the cancer also, there are certain signals other than the preventive factors, which I have already told, like so tobacco, obesity, all these things. There are the warning signs, like initial stages of the cancer, what things you face, so that you have to approach a doctor during that time. So there will be change in bowel or bladder habits, or repeated, there will be motions, or there will be alternate constipation and motions, or severe constipation, something like that. And there will be sore throat, or there will be a wound which will not heal properly. There will be growth, there will be bleeding or discharge, and either it is from the cervix or the vagina or whatever it is, discharge will be there, and unusual bleeding will be there, indigestion will be there, difficult to swallow, obvious change in a wart or mole. All the days it will be good, but all of the sudden within a matter of 1 week or something, the mole changes its size and appearance. So likewise, there is a difficulty in ingestion or to swallow, and there is a hoarseness of voice, change in the voice, or nagging cough. So here you can see the change in the mole, what, see all these pictures you can make out of how big it is, like, and also the thyroid mass. So how the change in the voice along with the typical appearance of the swelling in the neck. And if you see the breast appearance, there will be a lump or a swelling, breast lump will be there, and finally it will go in early stages, like you can make out a fullness or lump will be there. So then all palpation you can make out that one. In the advanced stages you can see like this, erosions also will be there. So what is this actually cancer? Cancer is a death one, or pain will be an early sign of cancer. Many of times pain will not be the early sign, and cancer is not the death one. All these are misconception. So if you ignore the symptoms, they will go away. Sometimes symptoms will be there. Then people are scared to get the tests done, because thinking that if they get the test done, if it is going to show some result, they cannot face that one. So thinking that one, they will never go and show. So like that, if you ignore whether it will go, definitely not. And don't ever think it is a cancer is a death sentence, because so many celebrities, look at it, this is from India, even more celebrities are there. So all the celebrities are cancer survivors and are very strong mentally, and are facing them, leading their life happy even after the dangerous episodes. So just don't get confused with or listen to anyone regarding this, or media regarding the misconceptions about the cancer. So don't ever think that it is a communicable one. When you talk to your near and dears who are affected with the cancer, don't ever think that talking to them you will get the cancer. And likewise, talking to never think that it is a completely hereditary. Sometimes it cannot be, it will not be hereditary. Only in few % of the cases it will be hereditary. Don't get worried that one family member is being affected and so you will get the disease, but be careful with the screening test. So with the screening test, maximum prevention will be there. Can we prevent the cancer? Yes, there are chances. I've already told the risk factors of the cancer. So most common risk factors. So those risk factors are preventable one actually. So those preventable risk factors, you can at least, by preventing them, you are going to reduce the risk of developing the cancer. And making the right choices which are there in your hands, you can do that one. Like having a sensible food choices, having a physical activity, and not smoking, maintaining the healthy weight. And also he having a plant-based food, because most animal-based food, chronically eating the animal-based food in excess is going to cause cancer. And prevent the prevent the obesity by having a good food, and thinking practically the causes of the cancer, or thinking practically in the life, and being physically active person. So like screening for the cancer means like looking for the cancer before these symptoms occurs. So this is very important step, because if you see the cancer in early stage, if you detect that even before clinically it becomes apparent, you can definitely curb this disease, or there is a definitive 100% you can lead a very good life in early detection. So screening is very much needed. It reduces the mortality and morbidity, and improves the prognosis, and that all the negative things like death is going to be inevitable. All these things there will be good reassurance and support if you show it in the early stages. So like what exactly is needed for the breast cancer is like breast self-examination of the breast, mammography, and clinical examination of the breast. Likewise, for the cancer, it is pap smear, human papilloma virus smear has to be taken. And colon cancer, colonoscopy, lung cancer, X-ray, sputum, and prostate digital rectal scan. Among this, practically, which is possible from your side, is screening for the breast and pap smear you can get. So let us move on to the breast cancer first. So as we all very well know that when we were kids, breast cancer was there, but less. But now it has become the second leading cause of cancer death in the woman. But if detected early, it is less incidence will be there. So death was inevitable in 1894, 100%, but in 2007, the rate has come to 15% with the advances in technology. This is the breast cancer images, erosion. Completely neglected breast swelling or cancer, fullness. So what exactly will be there in early breast cancer is like, there will be lump, there will be a swelling, and there will be also a discharge from the nipple, erythema. So like what are the advanced things? There will be ulceration, as I have already showed in the picture, and there will be dermal infiltration. That is, the skin gets attached. Skin over the breast gets attached to the chest wall. So the appearance of the breast will not be round, and there will be red appearance. Erythema will be there, and infiltration will be there. Ulcerations, and sometimes axillary lymph nodes. Lymph nodes will be seen in some small swellings will be seen in the axillary area. So who are at risk? So other than the risk which I have already told, preventable risk. So these are the other risk factors who can assess that they are likely or most risk, more at risk of getting the cancer. That is early menstruation, that is below 12 years of age, and after like menopause, attending the menopause, there will be on long-term hormonal therapy for more than like estrogen hormonal therapy for more than 5 years are at increased risk. And at childbearing age, that is age more than 30 years, or at like first child, if it is elderly primary, we say that one. First child born after 30 years are at increased risk of breast cancer, or people who are do not have children and any family history. And if you test mammographically, if there is a dense breast tissue, there you cannot identify the abnormal cells because of the dense breast tissue, even mammographically. So what exactly you need to do? Your contribution is that you have to, breast self-examination has to be done, and you have to get mammogram done after 40 years, once or twice in a year, and clinical breast examination with the caretakers or with the healthcare workers is needed once in a while. Let us go into this one. So mammogram, you all know about the mammogram, or do I need to explain about it? Yes. Are you listening to the talk?
Yes, ma'am.
Listening.
Yes, ma'am.
Yes.
Yes, ma'am.
Yeah. So do you want to know about the mammogram, or let us skip on this one? I keep asking because I just wanted to know whether you are hearing to my talk or no. So only three voices I can make out: Lavanya, Prabhakar Rao garu, and
Okay, madam, we are listening very keenly and concentrately.
thank you so much. So mammogram is a definitive way to assess the breast tissue. Here mammogram is because X-ray as you take, it can be taken out, you can see the film easily. But if it comes to seeing the tissue in the breast area, one requires a separated technique because breast is pressed between two plates of X-ray machine, and so it is flattened, breast is flattened, and the spread of tissue will be there inside, and then the picture is taken. So in that picture, one can make out whether tissues after within that tissue, any swelling is there, any mass is there, we can make out. Because what happens even with the self-examination also, sometimes the dense breast tissue, you cannot make out the swelling. So in such cases, mammogram is going to help a lot. So that's why once those who have completed the crossed 40 years of age requires mammogram once or twice in a year. So breast self-examination is also very important, and this actually is not going to benefit much because sometimes the false positive will be there, false negative will be there. Even the small things also will appear as a swelling to us, and it scares us, and sometimes when we miss it. So definitely self breast examination is not the definitive one, but to know like how the breast will be appearing and what gross abnormality, you can definitely do this self breast examination. How is it? Let me explain you how one has to do breast examination. Stand in front of the mirror um, with good light, unclothed, and then examine one's breast with arms relaxed at the side, above the head, and arms pressing the forehead like this, above and to the side. So in that three positions, one has to observe clearly regarding the size, shape, color, location, any flattening is there, any dimpling is there, indentation or retraction, how the nipples are there, all these things, any variation in the size between the breasts, all these things has to be noted. So for this, one can keep a good mirror in the bathroom. So before going to take a bath, once they become unclothed, then under good lighting, one can examine like this once in a while, at least monthly once. So this is the self-examination. And here one can also feel for one's breast in a circular fashion or in a circumferential fashion. So one can palpate with a different pressure from the pads, not from the tips. So from this part of the fingers, you have to press with a different pressure all over the breast area. So round 1 o'clock position, 2 o'clock position, 2 o'clock position from outer to inside. Then 1 o'clock position from outer to inside. Like that, clockwise, you have to check for the entire breast, both the sides. And once in a while, clinical breast examination with healthcare workers is going to benefit, but actually there is no clear evidence that this is the definitive way. Finally, it is the mammogram which is definitive, but two gross abnormalities can be made out with a clinical breast examination. So actually, when the clinical breast examination and mammogram has to be done, once in 1 to 3 years, maybe for the age 25 to 40 years, and annually for 40 years and above, clinical breast examination. Otherwise, self breast examination is required very often. But when it comes to healthcare workers, once in a year for above 40 years, and once in 1 to 3 years for 25 to 40 years women. So mammogram initiation age has to be definitely 40 years. And so if then, but if it is not 40 years, at least by 50 years, initiation has to be done to get the mammogram yearly or twice, once in 2 years. So one can stop if you are perfectly getting the test done until the age of 75 years, you can get the mammogram done. After 75 years, if you are not getting the mammogram done earlier in a perfect one, once in 2 years or like that, then even after 75 years, one has to get the mammogram done. So to be short and sweet, it is like above 40 years women, one has to get a mammogram once in 1 year or 2 years compulsorily. And this is regarding the breast cancer, which I have told. So basic things are basic, that is preventive things, which I have already told, that is obesity, having more fruits, physical activity, all pollution, all these things are contributing factors, major things, preventable smoking things, smoking and alcohol, all these things. And if it comes to the people who should be more careful about the breast cancer are those who have early menarche and after menopause having a hormonal therapy for a long period, and those who are so many factors which I have already told, like who have hereditary factors and a late child, not having children, all these people are more prone. Those people should be very careful. When it comes to cervical cancer, this is the second leading cause of cancer in our country, and mostly it is because of human papilloma virus. This is because of human papilloma virus, and this human papilloma virus infection occurs in the cervix. So what happens is repeated infections of human papilloma virus, that is discharge will be there that time, smell, all this. If you neglect certain those things, those cells which are repeatedly affected with the human papilloma virus will actually get converted into our normal cell will get converted into precancerous lesion, and that lesion will, I have already told like how it will multiply 1 to 2, 2 to 4. So that repeated multiplication is going to cause intraepithelial neoplasia. So this can be detected with a pap smear and colposcopy, that is examining the cervix. So all these tests are there for cervix screening. And if you see that this is the second most common cause in the Indian woman, and 1 in 1,32,000 new cases will be there per year. And death, if you see, it is 74,000 deaths per year. So due to the late presentations. And if you see, like every 7th minute, one woman dies of cervical cancer, very painful. And 1 out of 4 women who dies of cervical cancer is in the world is from India. Just think like how much of awareness we have to spread in the public in order to prevent this or detect it at the earlier stages. So do you want to know or see this picture, like where the cervix, endometrium and uterine cavity? You can see exactly this is the cervix area. is at risk of getting this cervix cancer? Cervix, because I've already told like breast cancer, it is more common or are at risk of developing the breast cancer. But now it comes to cervix cancer um, because of the area it is located, cervix. So early childbirth, multiple sexual partners, having more number of children, early marriage because repeated sex, and smoking, family history or hereditary, and using e-contraceptive pills, oral or e-contraceptive pills, unprotected sex with multiple partners. So all these things are at risk for developing the cervix cancer. So how can we prevent it? By early detection or by screening repeatedly, you can prevent this one. How is that? Definitely it is because of the infection. Most of the time cervix cancer occurs. So this can be because of, again, all these factors and less hygienic maintenance of the cervix. So, and all these factors leading to the infection, and this infection, if not treated, will go into the neoplasia and into the advanced stage. So getting the pap smear done once in a while, that is the collecting up of the cells from the surface of the cervix, and testing that, HPV testing, human papilloma virus. So co-testing with the HPV and PAP both is going to give a good results. And screening should approximately, when the screening has to be done is once get one soon after one gets married, or one have the sexual intercourse. So from that age, at least from 3 years after that one should get the pap smear done. So women are, so even without the intercourse, even if the woman who is at the age 21 to 29 years has to get pap smear every 3 years. So if there is any positive result, then they can go for HPV testing. So starting from 30 years, like 21 to 29 years, every 3 years. From 30 years, it is every 5 years. Get both the tests done when you are getting it done, PAP and HPV. So you can get it every 5 years. And another option is you can get only pap smear done, but you have to repeat it every 3 years until the age of 65. So once women cross 60 and who have already screened in the past 10 years and had negative results, can stop cervical cancer screening. So hope we haven't reached, all of you here have not reached, because to make it simple, let us consider one single thing, that every 3 years one has to get pap smear done, or HPV and pap smear for every 5 years from now onwards. There are vaccines, and this cervix cancer is preventable, and most of the time, around 90%, 90 to 98%, it is preventable, unlike breast cancer, because there is a vaccine available for cervical cancer. So this vaccine is bivalent vaccine, Cervarix. So here there are so many types of HPV types of viruses are there. In that, subtypes 16 and 18, 6, 11, 16 and 18 are very important, and rest are also important, but we don't have vaccine for them. So whichever is important, vaccine has been prepared for that one. So it is like for 16 and 18 targeting bivalent vaccines are there. Quadrivalent, that means that 4 types of HPV viruses, that is Gardasil is there, 6, 11, 16 and 18. So it is going to prevent against 4 types of subtypes of HPV. Both are licensed to use in India. It is approved. So here prophylactically immunization has to start even before the sexual activity. So when it has to be started is it has to be started from 10 to 12 years of the age. When child reaches 10 to 12 years of the age, that is the appropriate time to vaccinate these children. And this can be vaccinated up to 26 years. Actually, it is licensed up to 45 years. To gain the maximum results, it has to be 10 to 12 years. And first dose is given, second dose is given after the 1 month after the first dose with the Cervarix. If you have taken Gardasil, then it has to be 2 months from the first dose. And whatever is first dose or second dose, the third dose has to be 6 months from the first dose. So this is the intramuscular injections, and 0.5 ml will be the content of the vaccine. 0, 1 and 6. Any contraindications, any anaphylactic reactions to the previous dose or to any components of the vaccine, then it is contraindicated. Defer the vaccination if there is any illness like fever or pregnancy, you can defer the vaccine. And definitive treatments are there if it is detected early. Radiotherapy, chemotherapy, and surgical options are also there. So only thing what we can do is eat a good food and avoid smoking, avoid drinking alcohol if at all, if it is in the limitations, exercise regularly, maintain optimum weight. So all these things are very, very important, not only for preventing cancer, but even otherwise for healthy lifestyle. So it is going to prevent so many diseases by being healthy and maintaining the healthy lifestyle habits. So seek appropriate evaluation of or therapy for your risk levels. So if you are obese or if you have a smoking habit, or if you are not having good healthy eating habits, not physically active, then you are at very high risk, and so you need to check repeatedly for any, you need to evaluate repeatedly for all this evaluation which I have told, mammogram and pap smear. So if it comes to ovarian cancer, it is the third most leading cause of death, or leading in the incidences of ovarian cancers in women is the third highest one in our country. And here what happens is 11.9% per lakh population. And this is very, very lethal one. Once it, because Lavanya, can you just mute yourself? Lavanya Garu, can you just mute yourself? Lavanya Garu. So here what happens is 11 point, actually ovarian cancer is one which is going to happen start from the fallopian tubes. That is, you know very well that ovaries, fallopian tubes followed by uterus and cervix, vagina will be there. And these fallopian tubes, within the fallopian tubes, this ovarian cancer or that tumor is going to appear, or that neoplasia is going to happen, which is less visible area, less accessible area for us. And so the detection rate for the ovarian cancer will be very late, like stage 3 and stage 4. So patient will come to us with the at very late presentation will be there, and very vague symptoms will be there with the ovarian cancer. That is fullness in the stomach or dull feeling, and so like because and there will be swelling in the that gives actually a vague pain in the infraumbilical area. All these things are very vague, and so the detection of ovarian cancer becomes very late. The presentation also will be very late, and so the chances that this becomes more lethal, and chances of survival also very less with the ovarian cancer. So we all will celebrate World Cancer Day on February 4th every year. This is to prevent the cancer, like encourage or giving the awareness. Jyoti garu, please mute yourself. So here what happens is promote cancer awareness. We have to tell regarding the cancer and how it is going to go, what are the preventable things, identifying them, giving what are the treatment options. How government is taken the actions for this, and we should give, because what happens is cancer is a term which weakens mentally and physically. So people who are affected knows well about these things, how they are facing mentally and physically. So by giving awareness to the public, like what I am doing it today, you also can tell to your near and dears. So you are going to make them mentally and physically strong, and also you can detect the cancer early. By your words, you can at least make one life better. So this is a writings from the again a great celebrity who suffered cancer and dared to face it. I know the journey is tough, but one should be tougher than that. So if something is going to happen, we always think this is not going to come to us until it touches us. So then we go mentally weak and physically weaker. But that is the time you have to become more stronger than before to fight the cancer. So with this, I would like to end the talk upon the cancer. So you can subscribe to my YouTube channel, Dr. GK Healthy Lifestyle, where I have told about these dietary habits and exercises, how it has to be done, and how the healthy lifestyle has to be maintained, how we can prevent this obesity. So what exactly are the factors for the obesity and all other health issues, if you are suffering from, or if any one of your family members are suffering from diabetes, so you can go through the series, diabetes series, web series are going on in my YouTube channel. So by seeing, because I'm into fitness for past 7 years, and maintaining a healthy lifestyle for past 7 years. So if you subscribe to my, and I told like a high fiber diet should be there, like vegetables and fruits. So how it has to be taken, all those things is been told in my YouTube channel. You can look into my YouTube channel and ask for more information. If you have anything, like if you want to, you need certain videos, you have certain doubts, you can send it in the comment box in the YouTube also. So I'll be answering there also. It was started with a pure intention to help a public to know many things, and the topic is open for discussion now.
Madam, I saw some cases, some women without having any habits, you mentioned smoking like that, but they suffered cancer. So what's the reason, madam?
See, I said that preventable causes are there, high risk are there, high risk zones are there. So people, high risk hereditary factors could be their problem, or pollution, occupation, which occupation they are into, and they can be environmental factors. So maybe early, like which cancer, if it is like breast cancer, then early menarche, uh, long hormonal therapy, so late menopause, late children, and late first child. So not having children. There are so many factors. and presence of BRCA gene. So all these things are, so only things we can prevent, but whatever is like which has to happen through the hereditary or pollution or environmental things keep happening.
Yes, ma'am. Thank you, ma'am.
Girija madam,
Ma'am,
thank you so much for spending your very precious time with us
thank you, ma'am. Mhm.
and giving a very informative session. Thank you so much, madam.
Thank you so much, ma'am, for giving me this
Rupa
opportunity.
madam, Rupa madam ఒక డౌట్ అడగచ్చా మేడం ని?
చెప్పండి.
మేడం నా పేరు యువశ్రీ.
ఓకే, చెప్పండి.
ఇప్పుడు మనం ఇంట్లో కుక్ చేసేటప్పుడు అల్యూమినియం పాత్రలో చేస్తుంటాం కదా, అందులో చేయడం కూడా లాంగ్ రన్ లో క్యాన్సర్స్ వస్తాయి అని అంటున్నారు. అంటే అల్యూమినియం పాత్రలంతా చేయకూడదు, స్టీల్ వాటిల్లో చేయాలి అనేది ఈ మధ్య కాలంలో నేను వింటున్నాను మేడం. అది ఎంత వరకు కరెక్ట్ అంటారు?
ఈ సోషల్ మీడియాలో చెప్పేటివన్నీ వినద్దండి. ఎందుకంటే
ఓకే,
చాలా చాలా ఇవి వస్తాయన్నమాట. అంటే అన్నిటికీ భయపెట్టిచ్చేస్తున్నారు. అంటే ఇంకా క్యాన్సర్ అంటే చచ్చిపోతాం అనేలాగా చేసేస్తూ ఉంటారు. సో అలా కానే కాదు. చాలా అడ్వాన్స్ అయినాయి. చాలా అడ్వాన్స్ థింగ్స్ ఉన్నాయి. సో అల్యూమినియం పాత్రలో మన పూర్వీకులందరూ అల్యూమినియం పాత్రలోనే చేసుకుంటా ఉన్నారు. సో దాని నుంచి అసలు we cannot relate to those things. Just those are all false things, I can say.
ఓకే, 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 థ్యాంక్ యూ.
Any other questions? I'm really thankful to Swarupa madam for giving this opportunity, because unexpectedly it is like breast month week. This is like awareness month. So, and really I'm very happy, like madam giving me this opportunity and have given so much awareness, I think, to you all. Hopefully, like at least get the screening test done and examine your breast. Get the screening test done, what I have told. Like, don't fear that what is going to happen with the results. Just see certain people who have faced this one. And you know, Yuvraj Singh, so once he got affected with this cancer, he got the cancer, mediastinal cancer, he got seminoma cancer. So he's a cricket player. So he went to US, he got treated, and you know that stage of the disease is also advanced when it was detected to him. And so once he got treated there, he has posted all his photos. Like we can see people, cancer affected people, how they will be suffering. They will be always in the negative emotion that something is happened to their life, permanent damage has happened to their life, and so they will be losing their hope, because they have to take chemo, radio, and so many things will be happening in their life with that. But once you see how people who have dared to face them and living their life very happily, you know, after the treatment, he came back and he played the World Cup game, Yuvraj Singh. So that inspires us, like, this is not going to happen. If it happens to us, let us touch wood that this doesn't touch us. But still, if something happens to us, people have come out of that disease and they have faced the world. So if you read that Manisha Koirala book, that her book Healed, A New Life, and Gautami. So I was the one person who was there in that auditorium when Gautami, the movie actor, who told about a story, who was affected with a cancer breast at the age of 35 years, at very young age. So with a small kid, how she has faced that hurdle, and how she, by looking her, I never felt she is a cancer affected person, because she's very normal. And she started the foundation, New Life Foundation, after that one. to give awareness to all this and helping all the cancer affected people. So looking at that people, you feel that this is nothing. If at all, if it comes also, we can manage it wholly. So only thing you have to make your mind very stronger. People keep telling that and this, make this mind and give body what is required. Give yourselves what is required that time.
Namaste, ma'am.
Thank you, madam.
Thank you so much. And Manisha Koirala also, how she has faced, and they have faced every month treatment. They have faced, they have taken the selfie and posted the photos with a laughing, smiling face. You can see, go through the website. How happily, like they have taken it as a challenge and strong woman.
Namaste, ma'am.
Yes. Yes, ma'am.
Ma'am, this is Varalakshmi.
Yes, ma'am.
Ma'am, ఇట్లా క్యాన్సర్ ట్రీట్మెంట్ తీసుకున్న తర్వాత కూడా రికరెన్స్ పాసిబిలిటీస్ అనేది ఉంటాయి అని అంటూ ఉంటారు. అది ఏ పరిస్థితుల్లో సంభవిస్తుంది?
అంటే అది టిష్యూ ఏమైనా ఇన్ఫిల్ట్రేట్ అవుతా ఉంది, ఇంకా వేరే టిష్యూ మాక్సిమం తీసేసిన తర్వాత కూడా అది స్ప్రెడ్ అయిపోయింది ఇంకా అన్నప్పటికీ మరి అప్పుడు ఇంకా కీమోథెరపీ ఏ స్టేజ్లో అనేది చాలా ఇంపార్టెంట్ మేడం. ఏ స్టేజ్లో డిటెక్ట్ చేశారు అనేది. ఎర్లీ స్టేజెస్ అయితే డెఫినెట్లీ కంప్లీట్ ట్రీట్మెంట్ ఉంటుంది.
మళ్ళీ 2 years 3 years లేదా ఎప్పటికైనా అది ఉంటుంది బాడీలో, మళ్ళీ వస్తూ ఉంటది అని అంటూ ఉంటారు.
అంటే మనము కరెక్ట్గా దానికి చెక్ చేయించుకుంటూ ఉంటే అంతేం ఉండదు మేడం. ఇప్పుడు చాలా అడ్వాన్సెస్ వచ్చేసాయి.
ఓకే ఓకే.
సో ఆ ఫాల్స్ అన్ని తీసేయండి. ఎందుకంటే ఎస్, నేను ఇది విన్నాను. అంటే మీరు చెప్పడం మళ్ళీ రికరెన్సెస్ వస్తాయి, ఇప్పుడు తీసినా కూడా సర్జరీ చేసి తీసేసినా కూడా మళ్ళీ స్ప్రెడ్ అవుతూ ఉంటుంది ఇది అనేది విన్నాను. బట్ కంప్లీట్ కీమోథెరపీ, కంప్లీట్ రేడియోథెరపీ చేయడం వల్ల అది ఏదైతే రెసిడియల్ క్యాన్సర్ సెల్స్ ఉంటాయో అవి మనకు సర్జరీ చేసిన తర్వాత, సో అవన్నీ కూడా కంప్లీట్ కీమో రేడియోథెరపీ వల్ల కంప్లీట్లీ ఇట్ విల్ బి బ్లాక్డ్. మళ్ళీ మనం చూపించుకుంటూ ఉంటాం కదా వాళ్ళు చెప్పినట్టు. చూపించుకున్నప్పుడు ఏమవుతుందంటే అదేమన్నా ఒకవేళ మళ్ళీ వాళ్ళు ఎగ్జామిన్ చేసి చూసి ఒకవేళ కొంచెం ఉన్నాయి అంటే మళ్ళీ కూడా కీమో రేడియో చేస్తారు. అందుకే రిపీటెడ్ ఫాలోఅప్స్లో ఉండాలి.
ఓకే ఓకే.
వాట్ ఈస్ ద రిపీటెడ్ ఫాలోఅప్స్లో ఉంటే అయిపోయి అంతే కదా. జస్ట్ ఆ క్యాన్సర్ అనే ట్యాబు తల్లో నుంచి తీసేస్తే నాకు ఉంది, నేను మొయ్యాలి అంతే. ఇప్పుడు జీవితంలో మనకు ఎన్నెన్నో దేవుడు ఇచ్చింటారు, ఇవ్వకపోయి ఉండొచ్చు. సో ఇవ్వకపోయినవన్నీ మనము తీసుకొని వెళ్ళిపోతాం. నా జీవితం ఇంతే, నాకు ఇదే ఇచ్చాడు దేవుడు, దీంతో వెళ్తాను, నేను హ్యాపీగా చేసుకుంటానని హ్యాపీగా ఉంటాము. సో అలాగే దీన్ని కూడా మనము హ్యాపీగా తీసుకొని వెళ్ళాలి. ఒక ఛాలెంజింగ్గా ఉండాలి. మనం ఏమంటారు, చచ్చేదాకా మనము ధైర్యంగా ఉండాల్సిందే అనమాట. మనకు వస్తుంది అని నేను చెప్పట్లేదు, రాకూడదు మనకు, కానీ వచ్చినా కూడా మనం బోల్డ్గా ఫేస్ చేయాలి.
ఓకే, థ్యాంక్ యూ మ్యామ్.
థ్యాంక్ యూ.
Thank you, madam, for enlightening us, because in olden days, cancer cases are less, treatment levels are less, but nowadays the cancer cases are increasing. Treatment can be done to cure it. Thank you, madam, for giving valuable information to us. Thank you, madam.
Thank you so much.
Thank you so much, madam. Extraordinary lecture. It is very useful to our lives. Thank you, ma'am.
Thank you so much. So there are also other cases. So recently I have seen one woman, I came to know through my relatives. She is like my brother's friend's mother. So she is 62 years or 63 years old. So we always think that it is only breast cancer and cervix cancer which is going to affect us. But the history of her presentation was, she has never done any screening test earlier until 62 years of age, where she was not able to, she was having back pain, but little bit of back pain was there. So, but she used to do, at the age of 62 or 63 years, they do only household chores, that is cooking and all. So she used to do cook, and then she used to get tired, she used to sleep, and she used to go get vegetables from the market. So again, she used to sleep for a while, and she was doing her routine activities, whatever was there, but taking rest at frequent intervals. So what happened, like all of a sudden she was telling like she is having back pain. For that, their son showed them to the good hospital. They have written whatever basic treatment has to be given, that treatment was given to her. In spite of that treatment, she was having the pain, but still she was doing household chores. So one day while lifting or pushing the cot, she had severe back pain. Then after taking rest for one day, then she told her son, then they took her to the hospital. There X-ray was done. So X-ray, because with the treatment, normal treatment, basic treatment also, she didn't get the relief. So X-ray was taken on that day, same day. So X-ray was showing some abnormality in the spine. That is bones, spine bones. So there was like a lytic lesion. The bone was not healthy in multiple areas. So it was not healthy. So doctors got confused, and so they got immediately MRI done, immediately PET scan done. So PET scan was showing lesion in the lung. So the problem was back pain. She was having lighting lesions in the back. But when the PET scan was done, lung lesion was there, and there was a lesion in the labia, means like whichever vagina area before that initial thing, labia, outer structure of the private parts. So that area also there was a lesion seen in the PET scan, not clinically. So then there were multiple lytic lesions in the scalp, abdomen, stomach, so many areas. Primary was either in the lung or that should be the labia, that is not even cervix. So private parts, outer private parts of that woman. So then the primary was supposed to be detected where it is. Everyone was surprised that whether it is lung or the labia, because unexpected thing. So getting screened once in a while is the best thing I would suggest, because already spreading to so many areas in her case is like maybe stage 3 or 4. So I would suggest you all to get the screening test done and examine your breast repeatedly for any gross abnormality or any mass or any swelling. So kindly meet the appropriate doctor if you have any doubt, and get mammogram done, pap smear done. Don't get scared, because early stages is going to prevent. Early stages is having a very good treatment, and you can lead a complete life. It is
Ma'am?
yes.
Yeah, that was an extraordinary talk, ma'am. Really, it was a great awareness creating session. Prevention is always better than cure, and yes, you enlightened us in all sorts of ways in which the cancer can be prevented, and you alarmed us in many of the symptoms that could be expected in near future. So you're very true in every sense, because we cannot say in this generation or in this polluted world that there is not going to touch me anymore. Anything and everything can be possible, and we are seeing in these days and how the departments of oncology are getting rapidly extended these days. And the examples whom you have quoted, even Gautami Garu, the actress, she is a daughter of leading doctors, and still she suffered from breast cancer. And even Steve Jobs have to, he also got this pancreatic cancer, I guess. Yeah. So anything can happen to anyone. The session was truly extraordinary, and we thank you so much for such a wonderful awareness session, ma'am.
Thank you so much. So my request to you all, especially ladies, of course gents also, gender program. So then here we ladies especially are like least bothered about our own whole health. So health, it contributes only two things. One is exercise and one is physical exercise and diet. So diet is the one thing which contributes most of predominantly for well-being of any person. So exercise contributes to 5 to 10% of it, but more than 90% of the health is being contributed by the diet, what we are eating. So don't surrender yourself to the tongue with the taste or with your words. Mind your tongue and mind your words. So if you give everything what your tongue asks, then you will never be healthy. So if you go with what cells require, your cells require. So give them that to stay healthy. Don't please go away with your tongue. Manage your tongue. Your mind should be stronger than the tongue. Then you can be healthy. Because most of the time what happens is, in order to stay healthy, we keep doing dieting and all. Suddenly we get the urge to eat so many things which we promised today that we are not going to have any sugar, or we are not going to have some or the other thing we are not going to have. We promise ourselves today, but tomorrow when we look at that one, then again we do feel like having. So is it that our promises are for one day? Is it not that we are, just remember that only one thing will come through you entire life, not your ornaments. So not your costumes. It's your body which comes with you always. So if it is your body which is coming with you always, how you have to mind this body? So don't again look that you have to look very beautiful. For that you need to maintain this dieting and exercise. It is because you have to carry this body entire life. Whatever age God has given you, you have to carry that entire life, this body. So what type of food you need to give it to that body? Just see, go through the things like which is very good for your cells. What exactly is mechanism happening at the cellular level, organ level? What exactly is needed? How much of calories is needed for my body? Because if you are having like if you are carrying weight, what do? You keep it aside, that luggage, because you feel it's very weight. You are not able to lift that one, so you keep it aside. But what you are doing with your own body? You are carrying continuously one bag with your body, within your body bag, fat bag, with you always. No, definitely not. Please give what your body wants, what your cells want, what your organs want, not what your tongue or taste buds asks you. So you can stay healthy. And even with the smoking, even with the alcohol, whatever it is, see, no, people have moved to the very easy and very happy lifestyle with respect to the diet. What is there? Ek jindagi hai, what one life it is. If not, we are eating now, when we have to eat, all these things will come. Let us have, at least once we'll have. So that once will become twice alcohol, twice will become thrice. So please stay strict to yourself. Only person you can change is yourself, not other person. You can only tell other person, but you cannot change them. Only person you can change is yourself. You are in your own control, not others. Thank you so much. I'm moving away from the topic.
No, not at all, ma'am. But it is making sense in every sense.
Madam?
Yes.
Hello?
Yes, ma'am.
Madam, I too have doubt about aluminum vessels for using when Alzheimer's may be addicted, ma'am. Alzheimer's.
Alzheimer's disease with aluminum sheets, I don't have any idea, ma'am.
Okay.
Cancer, I can say no.
Recently, we have been listening about aluminum vessels very bad. That's why I'm asking you, ma'am.
Please don't listen to the media. Please don't
Okay,
listen
ma'am.
to the media.
Hmm.
They tell
Thank you.
today it is aluminum vessel, tomorrow it is steel vessel. Tomorrow, day after tomorrow, they tell earthen pots. Then
Okay.
in what we have to cook and eat. They have some certain their own products which would have been released into the market, and they want to promote that one, and they would say that aluminum is not good, steel is not good, earthen pot is not good.
Sounds very much like business tactics, ma'am. These days we are totally like out of the way, like what to believe and what not to believe.
So whatever is possible, whatever is so if you change the aluminum, no, I will not do certain those things. I will definitely not.
Even
Okay,
thing
ma'am.
happens with this non-stick vessels also,
Yeah,
ma'am.
ma'am. Non-stick vessels also.
They tell so many things, so many things. If you start, I told no, social media is will tell that every possible thing cancer will come with that one. Every possible.
Hmm.
So just
Okay, madam.
have
Thank you.
your own things like set your own things like what and all. Actually, go through the research things. Really, it is there, or like what this olden people from there, from whichever is
Ma'am,
the things you change, like obesity, all those eating, mindful eating, all those things, exercise. Yes, please.
ma'am, can you please just talk about this intermittent fasting that is getting very popular these days, at least for a minute, ma'am?
Yeah.
Is this really good?
Yeah, definitely it is good because I have been doing intermittent fasting for past 25 days. So I have my food at 12 o'clock and 7 o'clock in the evening. So apart from that time, I have only bullet coffee. Bullet coffee is nothing but a black coffee with ghee added to that, cow ghee added to that. And in between, if I feel any hunger, I can have green tea and I can have masala water. Masala water is nothing but here it is. I don't know this masala water. I had prepared this masala water and kept here. I'll add a lemon and a little bit of jeera powder and a little bit of salt to that. So electrolytes to add electrolytes to my body. So this I keep having often. If at all I'm having any hunger, I'll suppress. So everything will hunger. Everything will happen through the tongue will keep asking and mind will be asking because for a prolonged time you had fixed your stomach in certain way that you have to have morning, afternoon, night, and in between you have to have snacks. In between someone gives you can have. So keeping the sweets and that sweets will give that Pavlov's reflex will be there. Like, do you know or no? I don't know. Pavlov's test was done to a dog. So that Pavlov's pouch. So that test is like daily same time they will ring the bell and they will feed the dog.
Yes, ma'am.
So
Classical
one day
condition.
they will just ring the bell. They will not give the dog feed. So that day they will check the same amount of saliva has been secreted.
Saliva, yes. Yeah.
So that shows the same conditioning has happened into ourselves also. So we need to. So in that way, I have lost some 4 kgs. It is like that's why I'm telling. I'm into fitness. I'm an athlete. So I'm an athlete and a carom chess player. I'm a fitness freak actually. So you can watch my YouTube channel. So all
I
the
will watch it, ma'am.
there I have told like actually with the exercise you are not going to reduce the weight. It is only like very less weight you are going to reduce with the exercise. But with the diet is the contributing factor, major contributing factor for our weight or healthy lifestyle. So for that diet, it is only the tongue which is going to spoil us, tongue and mind. Even if tongue and mind ask, you should be so strong that you should not feed your stomach. Then over time, it will get habituated.
Okay, thank you, ma'am. Thank you for that.
Thank you so much. Even type 2 diabetes also is reversible, like those people who are on tablets, medications. So completely they'll become normal with the diet.
With intermittent fasting, ma'am?
With intermittent fasting and with not intermittent fasting, with weight reduction, appropriate weight reduction. Some people will lose weight dramatically, but what happens there should be no protein loss. Muscle loss should not be there. Muscle should gain and fat should lose. That should be our target. So in trying to do fasting, if you lose the muscle, again, you are going to gain the fat very easily. There is a connection, correlation. So when you lose weight appropriately, then the diabetes, whichever type 2 diabetes, that is people who are diabetic and are obese, with appropriate and good dieting habits, can reverse that diabetes completely without any medications.
Thank you, Madam Girija, Madam.
Thank you so much, ma'am.
We are really happy to associate with you, Madam.
Thank you so much, ma'am. And thank you all for patience listening. So nicely you are asking questions and I'm got engaged.
Thank you very much, madam. Thank you very much.
Thank you very much, sir. Thank you very much.
Thank you, madam.
Thank you. Ma'am.
Thank you, madam.
Thank you, Naganna garu.
Thank you very much, madam.
Thank you, sir. Thank you so much, sir. Girija, sir. I was thinking like no one is listening, but with this response, I could make out like you are listening to my class.
No. The topic is quite interesting, and we were like keenly listening to you, ma'am.
Actually, I am a motivational speaker and a public. I have done public speaking course because you might think that doctors talk, but whatever I have learned, like teaching skills or talking skills, is not through my medical profession. It is only after doing my public speaking course and being in that arena. So developing continuously. That's how I'm able to give this talk today.
Yes, madam. That's why you gave us a good explanation about the cancer, ma'am.
Yes, ma'am.
And all at all.
Yes, ma'am. That's why I am very thankful for the Impact Foundation for making me to speak in the public. Hope there are no questions, or if any, we can take another 10 minutes, sir.
Ma'am, there are quite a few doubts which couldn't be asked on a public platform. If possible, could you please share your mail ID, ma'am, if possible?
I'll share my phone number. Actually, I don't check mails often.
Okay, because doctors,
No,
like
phone also, I might not pick up a WhatsApp message. If you keep, I'll definitely respond to that.
definitely, ma'am. Please.
I just sent my number.